As a patient here at the National Dizziness and Balance Center, we are going to use a team approach to determine what the cause of your condition would be and how we can best treat it. Now, when we're dealing with problems of the balance or dizziness, there are typically several common conditions that are going to be the most likely cause. And in older individual or someone who's had a head injury, we may be talking about damage to the cerebellum, a circulation issue or head injury issue, which can cause a biochemical change in the cerebellum, affecting the balance and causing dizziness. In the general population, from children to older adults, there can be damage to the inner ear. The inner ear is located behind the eardrum. It's a very small organ that can be damaged by head injury, ear infection, sinus infection, viral infections, and a host of other more obscure causes. It won't be diagnosed with an MRI scan or a CT scan. We have to do functional testing of the inner ear to know what's wrong with it. There's also the possibility of a mechanical issue in the inner ear where the tiny crystals called otoconia can be displaced. Their job is to tell the brain the position of the head after you move it. And so they move about with the head. If they're displaced, which can happen from a sudden head movement, they will go up into one of these semicircular canals where they don't belong. When that happens, a person moves their head a certain way, they will get dizziness and nausea, imbalance, and that condition will persist as long as those crystals are out of place. Now, those are the main conditions we deal with: damage to the inner ear, displacement of the crystals, or a problem in the brain. All of those conditions can be diagnosed very quickly and efficiently through our clinic, and we can offer treatment for all of them.